Hi, my name is Yulia. I'm going to show how to do G-tube feeding today, and the mid-administration through G-tube. So I'm coming to the patient room. I'm doing my hand hygiene. Hi, my name is Yulia Glass, nursing student, Nevada State College. Could you verify your first and last name for me, please? So patient tells me his first and last name, date of birth. I'm verifying the information with my MAR that I have. Looking at the patient wristband. That's the correct patient. I'm looking at the records, and I'm looking that this patient is going to need this procedure. So I'm going to explain my patient that what I'm going to do and how he can cooperate. So then I'm going to lift up the bed to the comfortable working height. I'm gonna put patient in a further position. I'm going to open up the stomach, J, gastrostomy. I'm going to look if there is any redness or lesions present. So there is no lesions, there is no redness. So I'm going to wear my gloves, my clean gloves. Then I'm going to ask the patient if he has any allergies or to the medication or to the food, any food allergies. I'm going to verify that. So, and then I'm going to listen to bowel sounds. So, bowel sounds are present in all 4 quadrants, meaning that I can proceed with my feeding. Before that, I'm going to verify my placement, G-tube placement, that it's in the stomach. I have the syringe, equipment, I have syringe, a cup, pH strips, so I can have my syringe, and I can do the I can aspirate 5 to 10 ml, and then I'm going to check the pH. pH of the stomach should be 5 or less. So that's the correct placement of the tube. Now I'm going to aspirate the stomach, the content of the stomach. If it's less than 100 ml, then I can continue, go ahead and proceed with my feeding. So the patient has 30 ml of gastric stomach, and that's all he has, meaning that I can continue with my feeding. I'm going to put the gastric stomach back. I'm going to draw out the syringe, take out the syringe, and then I have a kangaroo bag to set up, and I have my feeding containers. So I should warm up food to room temperature, and I will sanitize the top. Just say this is a container with the food. I'm going to sanitize the top with alcohol. I'm going to, before I take my kangaroo, make sure the clamps are all closed, and then I'm going to transfer the food from the container to the bag. Before that, if it's a new bag, I actually have to prime my tubing. I will prime my tubing with sterile water. basically I just add a little bit of the water into the bag, and I will prime the tubing, so there will not be any air in the tubing, so patient will not have any extra air. So let's just say that this tubing is primed with water, so I clamp it back, there's no leakage, and then I can transfer my food from the container that I already cleaned and warmed. So I'm transferring the food, goes in the container, and hang the container about 30 centimeters above the patient tube. So the container is right there, and then I can attach the spike to the G tube. Okay, so I'm attaching the spike, and then I'm going to set the pump. So basically setting up the volume and the amount of time that it's going to be administered over. Okay, so 60 milliliters per hour, the rate of the food, and then I'm going to press start. And before that I unclamp the tubing, and then I press start. So it's running. So I'm assessing my patient, how he's doing, if he's doing okay, and I'm going to document my procedure. I'm going to document date and time, the food, the amount of food that I administered, patient response, and the type of food. Now I'm going to show, well, of course I'm going to dispose my gloves, and then I'm going to put my, after the feeding is over, I still have my patient for 30 minutes in sitting position, and then I can, if he wants, I can put him in a supine position. So I'm done with my feeding. Of course I'm going to dispose my gloves properly, and I'm going to do the hand hygiene before I leave the room. Now I'm going to show how to do the medication administration through G-tube. So again, coming into the room, verifying patient, ID, first and last name, date of birth, medication, the route, the dose, so 5 rights of meds administration. My patient is going to have, let's say, Tylenol, 1 tablet, that I have to administer through the G-tube. Well, again, before I administer anything, again, I'm verifying the gastric placement, and then pH, so that's gastric placement, and then I'm going to brush my tablet. Of course, before I do anything in the patient room, I do always my hand hygiene. That's important. So I'm going to put the powder in a cup. Again, have some steril water. It's steril water again, verifying the expiration date. I'm going to mix the powder with the steril water. So it's mixing. And then I'm going to check patency of the G-tube. I'm going to have the syringe. I'm going to wear my gloves first before the administration. Syringe. So let's check patency. So 30 ml of water. So and let's just wait that it goes down. So meaning that it's patent. And then I'm going to have my solution of my med or suspension, whatever it is. Just transferring through the syringe and let it drain to the stomach. And then I'm going to fill the cup with another 15 to 30 ml of water, and I'm going to flush it down through the syringe. And let's wait that it's going down. So it's all done. And then I'm going to close it up. I'm going to assess my patient. I'm going to clean up everything, and I'm going to document medication administration, the time, the date, my initials, purse, patient response. And then I'm going to do hand hygiene before I leave the room. That's it. Thank you.